Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Just a regular appointment to see your doctor? Or if something is happening with you? No. The doctor's office will tell you, go to the emergency room or go to urgent care. Yeah.
And you know what else? The irony is that they say, early detection of a lot of diseases is key. And so if you wait so long, then how can you also have early detection?
Well, early detection is about screening. And screening means that you don't wait for symptoms. And what you're talking about now are symptoms, so people having symptoms. Whereas the ounce of prevention is worth a pound of cure relates to going to see the doctor when you don't have any problems and no symptoms. And that's when you can make a difference. The question is, how many people actually go to see a doctor when they are well and take advantage of the screening that occurs. And but what is not so positive about the article is that the data suggests, because doctors are experiencing burnout and other things, that this is going to get worse. It's not going to get any better. They also suggest something that you would find interesting, is that if the doctor has nurse practitioners or physician assistant, make an appointment to see them instead of the doctor, and you're more likely to see somebody sooner than later. And any comments about that? Any of you comfortable seeing a nurse practitioner or a physician assistant?
Lots of times when you make an appointment to see your doctor, once you get to the doctor, it's the practitioner, not the doctor. But I'll give you a prime example really right now. I know you all heard me speak of, after my hip operation, I ended up with dropped foot. And I noticed the other day that I had a little bump right at the bend of where my foot and ankle. And I guess I thought maybe it was a blood clot, or, not really knowing what. And I thought to myself, it's going to take me a long time to get to see my doctor, or else I'm going to go and have to go to the emergency room. And the last time my husband went to the emergency room, he was there for 14 hours. So I didn't relish that. So I happen to have a friend who is a nurse, and I took my foot to her and let her examine my foot to see whether it was a blood clot or not. And she determined that it was not a blood clot. So I'm little, less anxious about it. But that's just the level of care that's available right now.
Sounds like a crisis to me. That's really sad, because it's interesting. They say 26 days and you say 2 months. And I get calls all the time, and I try to make appointments for people, and I run into the same problem. But one of the issues is when you go to the urgent center, you may get a resolution of the acute problem, but the long-term follow-up is still missing. And that's why the hope is that you have a primary care physician taking care of you, who can then identify who you should go to for another opinion about something. And so, how many of you actually have a primary care physician?
I have one.
Because if you have a primary care physician, they can facilitate you seeing somebody else and shorten the waiting time for you. Is that not the case for you?
No, not necessarily.
No, not necessarily either. I mean, I still don't think my primary care physician really know me. I think it's still more or less like, she rolls in with the computer, she'll talk, be cordial. But to know me and to personally know me, I find that my doctors don't do that. I mean, they just get you in there and get you out of there.
That's
Remember,
sad commentary on the
It
healthcare
is. It
that
is
we're
sad.
delivering.
remember
I
I
can't
told
even.
you all. Remember I told you all that I was having my yearly physical on the phone,
Oh,
and
on
that's
the phone.
on the phone, a teleconference on the phone, and that's what
Really?
she did. That's my primary physician.
Wow.
Fortunately, I don't have any major health problems. Maybe that's why she did it that way. But her analysis, she just asked me some questions like we were talking about last week about, whether or not I was getting dementia, that backward counting and all of that stuff. She did that. And then she asked me about my blood pressure. Now, if my husband didn't have a blood pressure machine because of his diabetes, I wouldn't have a blood pressure machine. So, but she asked me how my blood pressure was. And she just asked some general questions. And that was it. That was that. I've been going to her for, I'm sure 10 years, 8 years, 10 years. I feel like she knows me, but she doesn't, it's no interaction really when you go to I might as well sit home, because other than getting my blood pressure and stuff, when I go there, it's no touchy or let's lay down and let me examine you. No, they don't do that anymore.
Oh, that is so sad to hear.
They do not do that anymore.
That's unfortunate.
Well, on the other hand, I've got a good relationship with my primary care doctor. He's kind of new because I moved 2 years ago, so I had to get one closer to home. And the relationship is so good that he wants to be on my mailing list to come to some of my shows. But the problem is that he's going to retire in the next 5 years. And, we got a doctor shortage. And they say a third of all the doctors working now are expected to reach retirement age in the next 10 years. So that's going to drive up the doctor shortage even more.
Wow, it's a real crisis. And then the burnout phenomenon is taking others away as well. So this is really a crisis. I had someone come to me with a request about a specific specialist. She wanted a rheumatologist, and it was difficult to find. Matter of fact, they're few and far between to find rheumatologists in the DMV area, and it was a difficult chore to find somebody to see. So if you want a specialist to see you, it becomes even more difficult. So we really, it's amazing that even right here in the DMV area, which is allegedly ripe with physicians, there's still a problem. And the waiting, it's interesting because the waiting time that they have in this article is much shorter than what it really is.
Yeah. My husband even he was having trouble with pain in his jaw. And he didn't want to just rush to the hospital, except for his diabetes. He does that religiously, but he kept having this pain. So finally he said, I'm going to urgent care. And we went to urgent care, and it took maybe about 3 hours, I think, 3 or 4 hours. But they looked at him and first said, it has to have something to do with your teeth, your dental. And he started laughing because he said, I've had dentures for over 10 years, so I don't have any teeth. So what? So they sent him from there. Their recommendation was to go to the emergency room. And that's when he sat in the emergency room for 14 hours. And they did run plenty tests, he said, but they finally sent him to a specialist for stenosis. And now he went to see him one time, and then they did an MRI so he could get really what the problem was. Now that was almost a month ago. His next appointment after the MRI is the 1st of December. So that's how.
Oh man,
yes. So
that's really sad.
it's just the way it goes.
Wow. So that's just the tip of the iceberg.
Yes.
It's really bad.
Well,
Wow.
from a patient standpoint, I can't say that patients are fans of specialists. You know, if you have a good primary care doctor, you want him to do it all. But then, especially like if you get into advanced health problems where you have a cardiologist, oncologist, you know, the list goes on, and you don't feel like any of your specialists are talking to each other. And then you start getting into drug conflicts uh, because this one specialist is prescribing medicine that conflicts with what another specialist is prescribing. You know, you wish that your primary care doctor was managing it all, but you don't feel like they're managing the whole process. You feel like they're just an observer keeping track of everything your specialists are doing.
Family doctor is gone.
You know, it's interesting that you would say that, because when I went for my 60th reunion, there were 3 of us who showed up. One was a family doctor, and he still does home visits. But as you say, they're few and far between. Old family doctors and people who really care about you and come and visit you and see you and all those kinds of things. It's amazing, though, if you grew up in that era, you really understood what a primary care doctor and a family care doctor really was. This day and age, it's not even conceivable. And the way you talk, it's far cry from what it used to be, and it's getting worse all the time because doctors are burning out and other things, and as you mentioned, retiring, and so that it's a real crisis that we really haven't done anything about. And it's interesting that in this article they have about 10 different ways of finding a new doctor, but one of the things that they emphasize is leaning on your primary. But you're saying the primary is not much of a primary. Yeah. Wow. Well, you know, that means that, wow. Okay. I'm going to see if I can get some of these primaries to come and talk to us about that over the next couple of months, so we can ask them. I know Dr. Obisa-san is a geriatrician, and geriatricians are few and far between as well.
Right.
And of course, that's the kind of doctor that we need. And when you're over 65, they say a geriatrician is probably the best for you, but you can't find that many geriatricians. So, okay, well,
where was your doctor that your primary doctor that still did house visits? Where does he live? Not in this area, I know.
Not around here.
No, not
No,
in this
he's from
area.
Ohio. And
Rural Ohio.
and he's 90 years old.
Oh,
Well, I just did a quick search on what countries do not have a doctor shortage, and the answer is there are no countries that don't have a doctor shortage. So, moving
Wow.
somewhere else doesn't solve the problem unless you want to move to a healthier country. But that's just because their lifestyles are healthier. It's not because they got enough doctors, because nobody has enough doctors.
Yeah. Well,
Dr. Callender,
yes.
my parents were in a program and they still have it in DC. There's a group of doctors out of Washington Hospital Center called the House Call Program. And the people have to be, I think, housebound over 75 and housebound, or if you're 90, it doesn't, and you're housebound, they come to the home and you see a physician, a nurse practitioner every month, and you see the doctor 3 times a year unless there's a problem. And they bring x-rays machines to the house, Doppler machines. They take your blood. They do everything from the home. And it was a good program. I was taking care of my parents, and I had my parents in that program. And it's still an ongoing program, and it's very good. And they're gerontology. That's what they specialize in, medicine for older people. And they have, it's in Washington, D.C.
Well, why don't you why don't you email me or text me and give me the name of somebody from the practice, and I'll see if I can't get him on the program.
Okay. All right. I will.
Okay. All right. Thank you very much for that information.
Yeah.
On the same note, my sister, who's in an assisted living facility, she has those same services because her assisted living facility is like she's in an apartment. And so that's like her home now. And so all the doctors and nurses and medicine and all that is coming to her. And that was the exact reason why she had to leave her house, her real house, because she was there by herself and nobody was going over there. I mean, she had people come in, 8 hours and do this cleaning and that, and then they're gone. But in this assisted living facility, she has 24/7 care, doctors, nurse practitioners, everybody. Laundry people come in and wash her clothes, everything. She got everything.
That's great. That's great.
Yeah, it'd be interesting to talk to her to find out if that's really true. Because you're surrounded by that doesn't mean necessarily that they come around to see you. But it'd be interesting to hear her perspective of that.
Yeah, they give her medicine on schedule.
Yeah, they do that. Yeah. I just thinking back when my mom was alive, she died in 2001, but there was a family physician who did come to the house, and he was an older man, older doctor. I don't know his age, but he was elderly then. And he still had his practice. His practice was on Benning Road somewhere, but he did come to the house. She was a heart patient, and he would come to the house. He did regular house visits, but I haven't heard of anybody since then that has had just a regular doctor come to their home. But like I said, she passed in 2001, so that's a long time ago.
Yeah, okay. Well, John, do you want to go to the first article, please?
Sure.
Interesting. Interesting that this will be the first article. But this is something that we've talked about for some time, and that is that some people think that people over 65 should be tested periodically to see if they should still be practicing medicine. And here's somebody who recently sued because they have mandatory cognitive tests, which violates the ADA Act. And so it's going to be interesting to see what happens because as you can see here, Henry Ford requires all members 70 and older to undergo cognitive screening tests every 5 years after. Anyone who refused would have to resign or be fired. That's an interesting thing that not too many places have been bold enough to do this because they realize it violates the law. So it's going to be interesting to see. You can see that 12% of physicians were at least 70 years old and so it makes sense to have screening programs like this, even though it is against the law. So the question is, this lawsuit will have a tremendous bearing on whether or not you can actually do tests like this and have people demonstrate their cognitive abilities or resign or be fired. And so it's going to be interesting to see how this stands up in court. Any thoughts about it? And how are the doctors that you see who are over 70, how was their performance? Did you think any of them required additional cognitive testing?
I don't see any now over 70, but I used to have a doctor who was aged, and he was fine. He was one of the last doctors that actually examined me.
That's a sad commentary. That's a sad commentary.
My primary care doctor is over 70, and he had talked about retiring and then going into some kind of service. I forget the name of it, where they're only working with you. I can't think of the name of it. Anyway, I love him. And of course, there are many doctors out there. I'm not quite sure how old he is. Definitely he's over 70. I think he's between 75, 80, something like that. And I've moved out of that area, but I continue to go to him, and I will continue to go to him because I trust him. He's patient and he's very thorough. I think it's based on the individual and the trust and relationship you have with that doctor. Age, in some cases, well, in this case, it doesn't matter with me. I mean, he's older, but I think he's knowledgeable. I trust him. He's thorough, and I'm not going to leave him until he leaves me. I'll put it that way.
You're blessed.
I am. I trust him 100%. Even though I got a little leery after we spoke about this last week about he started a few years ago, and I guess that was when I turned 70, of doing these cognitive tests for me. You know, say a few words, and then he has this long conversation. Oh, what was that we were talking about earlier? And then he did something where there a picture of interlocking octagons, a shape. And he asked me to draw, see if you can duplicate that. And just a little testing he does with me to see how alert I am or what my cognitive skills are. But I'm good. If he's checking me, he's fine. He's thorough.
Any other commentary? If not, it's interesting. Some doctors are like fine wine.
Oh, yeah.
Better with age.
Well, you know that, Dr. Callender. You have lifelong patients, and they wouldn't dare leave you. So it's trust.
Yeah, that's what it's all about. Yeah.
Yeah.
I kind of think And that could be wrong, but I don't know. I just think that the older doctors were trained differently.
Mhm.
It appears that they were trained differently than the younger doctors are now.
Mhm. Mhm.
It seems that way, doesn't it? Although that should not be the case, because I still go to the Freeman's Clinic, which is a clinic for patients who do not have any insurance,
Mhm.
and they still have the same training. They still required to do physical examinations, histories, and physicals. But the thing that I notice is they tend to want to rely on X-rays and lab tests and other things more than the history and physical examination. But they still, in medical school, are taught the same history, physical examination skills. The problem is that after they finish medical school, they become more reliant on the other aspects of it, and forget that 90% of the diagnoses are made based upon history and physical examination alone.
The doctors of today walk in the room with their laptop. You know,
And they do. And this older doctor does to say, he comes right in. Hey, Janice, how are you today? And he sits down with that laptop. He knows more about me than I know about him. What happened to that appointment with Dr. Jones last week? Did you see him? Well, I know you did because it's all in my laptop. So he's up to date on all of that. He's good. I like him. It was concierge service, something like that, Dr. Callender, that he was going to go into. And yeah, and it would reduce his patient size, and you pay differently. And he said, I'll give you more attention. Well, you give me all the attention I need now. He takes his time. He will come in and put that laptop up and go through all of my previous appointments and what's scheduled recently, test results. I can't ask for anything more than that. Yeah.
That's ideal.
Mhm.
Okay. Let's go to the next article, man.
All righty.
It's interesting how that over time things change, but they don't always change for the better.
Mhm.
But they certainly change. Now this is
Yeah.
additional news. We were just talking last month about the fact that the pre-heart recipient was doing well and had no complications. Now we see that he's died, and it's a setback again as we try to find a source for donors. As we know that 17 people die every day because of the shortage of donors. So this is an effort to use the pig model as a donor because we don't have enough human donors. And so this is a setback for this process because it's well, they've only had 2 done, but both have died within 2-month period. And so the question remains now, what went wrong? And so we'll have to wait until they look at all of the reasons why the rejection occurred and why the patient died. This is the longest survivor so far, 60 days. So it's a little disappointing because we hoped that this would be the beginning of something that would result in more transplants from other species. So sadly, we'll know over time what happened, because the first 30 days were great. But okay. Okay, any other comments about this xenotransplantation, which is hopefully the way in which in the future we'll have a way to prevent those 17 people, 17 people who are dying every day because of the shortage of donors.
Yeah, this is kind of a sad commentary as well, because we were looking forward to, as you said, increasing livelihoods. But now it's almost like they have to go back to the drawing board. And as you said, they got to figure out where the rejection came from, how it happened, and what they could do about
it. Yeah.
My thought process is the fact that they all, in both these cases, this was the very last resort, they said. So does that mean that the patient was so close to death already? I mean, maybe if they, I know it would be kind of crazy to do it, but if someone would volunteer that's not quite that bad off, maybe the pig transplant would work.
Well, that what you say is very true. However, since it's experimental, that's how you get permission to proceed, because there's no other option. But I think your point is very well taken. And I think after they've analyzed why this heart was rejected, then they can come up with some ideas. But until then, we just have to wait it out. But your point is well taken. I think xenotransplantation is something that we'd love to see come to fruition, but we have to wait until we're able to analyze and get to the point where, as Baylock has said, that we can do it on patients who aren't on death's door. Yeah. Okay, let's go to the next one, please. But it just underscores the fact that the shortage of donors is the #1 problem with transplantation today. There's an article that we've had discussions about, but we haven't really talked about it. And this is a challenging title. Can engaging in oral sex increase your risk of head and neck cancer? And it points out that oropharyngeal cancer rates have increased steadily, and they're related to the virus, human papilloma virus. And this is present in most humans. And oral sex is a significant risk factor. Smoking and alcohol as well are risk factors. But what we have not discussed is what role does oral sex play as a risk factor? And it is clear that the human papilloma virus is transmitted by oral sex. And of course, we now have a vaccine that we want children to take in school so that they have antibodies, and therefore they will not develop cervical or oropharyngeal cancer. Cervical cancer is still killing people because they get the human papilloma virus because they aren't vaccinated. And so, although there's double the rate of oropharyngeal cancers in men, it alone is not responsible. Smoking, alcohol are still the commonest factors. But it is clear that HPV-associated cancers occur. And it's something to think about. And so the question is, how many men actually, and this article says 70% of the head and neck cancers are caused by HPV, which is the virus we're talking about. So it's clear that this is as a disease that is preventable by the vaccination and also by avoiding oral sex. And what has not been studied yet, and that's what the rest of the article talks about, is how do we know that this is a real factor, a cause-related issue? And it's clear that the virus is associated with the cancer. The question is oral sex the major way in which this virus is transmitted? And when you talk about condoms or dental dams, I don't know what a dental dam is, so but
Doctor, a dental dam is just a sheet of plastic that a dentist place in the mouth when they need a dry field.
okay.
So it's a square piece of plastic.
Okay.
And they come in boxes, and it would cover the mouth area. So
and
it was
maybe
used.
the tongue as well, huh?
Mm-hmm.
Yeah, okay. All right, that makes sense then. That would be a way of it would be the equivalent of a condom for the tongue kind of thing. And
Right.
yeah, and it probably sounds as attractive as having a man put on a condom, but of course, if there are two options, one is the HPV vaccine, and the other is the dental dam. So,
Well, grown
the
people
vaccine.
don't get the vaccine because we've already been exposed to it. Is that what the situation is?
Well, if you're 45 and older, then it's too late for the vaccine. But if you're
Right.
young,
That's what I'm saying. We've always been exposed
right? Yeah,
to it
yeah,
at some.
right.
Mhm.
And so, if you're under 45, you could get the vaccine, and it could be helpful. But the younger you get it, the safer you are with it.
Yeah. Mhm.
Well,
Doc-
this audience is mostly women, but it's helpful for men to understand this is another risk factor for oropharyngeal cancer. And the parents and grandparents to make sure that their males and females get the HPV vaccine.
Mhm.
Because most schools require it. But you have some parents who fight it because they don't like vaccines at all. Anyway, so.
Dr. Callender, do you think that this increase in the cancers has any correlation to the fact of same-sex couples?
I don't think so, but because oral sex occurs in same-sex and heterosexual. So,
yeah, but
I'm not sure. I don't think that has been analyzed, and that's another thing that needs to be analyzed, but
So
oral
many
sex.
more same-sex couples today, they marry and they, so it's
That's true. Yeah, they do.
so many more now than,
Yeah,
at least
but
more than we know of.
yeah, a lot more than we
Right.
Know of.
But
Yeah,
I would
they've been
suspect
there
that,
all the time, but just more than we know of. So maybe,
right.
yeah.
But I would suspect that many more would be occurring from the heterogeneous route with the male and the female being the conduit. Cunnilingus is a practice that is rarely discussed among men, but is a practice that occurs nonetheless.
Mhm. Yeah.
But they didn't address that question that you posed, which is a good one, because the presumption often is that the oral sex is occurring between the male and the female. But as you pointed out, that is often the way in which males and males have oral sex as well. So we'll move to the next one, unless there's any other discussion about this article. In this day and age, our children and are interacting with families of heterogeneous and homosexual situations, which was rarely seen before 20 years ago. But now it's something that we see often. This is Lung Cancer Awareness Month, and we now are talking about lung cancer screening, especially to people who are current or former smokers. In the past, lung cancer screening was really only for those people who had 20-year or greater year history of smoking. Because of the increase in women, cancer in women and younger women from 38 to 54, they're expanding it so that many more women who haven't smoked longer than 5 years are now being included in the screening process. The screening process is that you have a lung scan, which so if you have not smoked for 5 years or longer, they have not been including you in the screening process. But because of the fact that lung cancer, #1 cause of cancer deaths in the United States, and because deaths are so common, the screening criteria are now being applied to people who smoked for 5 years or more. Although it's without question, if you have a 20-year history, but because of the high risk of death with lung cancer, and I'd asked before if many of you know people who have died from lung cancer, and an early detection of lung cancer may perhaps prevent the number of deaths, so that they can have surgery or therapy directed to them before lung cancer gets so far advanced.
Dr. Callender?
Yes.
I was in a study back in 20 I think it was 2015. No, 2013, I think it was. I had smoked for 40 years and I stopped smoking. And I got into a study where they gave you low dose, low dose radiology.
Yeah, screen. Mhm.
Right. And I was in a program where they did that. They took different people from, depending on how long you smoked, how long you had stopped, and they did it all the way up until well, I was with the program for 5 years, but they stopped because I had thyroid cancer and they didn't want to expose me to radiation anymore after that. But I was in that study for the low dose radiation.
Right. Okay. Interesting. Thank you for sharing. And I think the fact that it's occurring in people who are 35 to 54, 38 to 54 is frightening. What is interesting is that younger people still smoke.
Mm-hmm.
And of course, in Europe, people still smoke as well. The poison that we've created is used all over the world. And so the hope is that with lung screening, that we can pick up cancers early and decrease the fact that lung cancer is the cause of more cancer deaths than any other cancer. Okay, well, any other comments? If not, we'll go to the next article. It's interesting, how as a young person, it was the right thing to do to smoke. And so those of us who never smoked weren't thought of as fashionable, but now we find that there's a price you pay for smoking. Now, this is an article that says that 70% of cancer deaths are preventable, and that's an interesting comment. But when they talk about it, they talk about dietary changes, smoking cessation, and looking at all of the different ways that you can develop healthy lifestyles. But when push comes to shove, the bottom line is that from their perspective, 70% of cancer deaths are preventable. But that's also recognizing that cancers associated with ultra processed foods is a common cause, and also the fact that screening, taking advantage of the screening that occurs, is also possible. And so this is why they are saying that that 70% of the cancers are preventable if we change our lifestyles, avoid smoking, avoid alcohol, and eat healthy. Perhaps more easily said than done, but nonetheless is something that we have to really take seriously as we age. And this is something that is particularly common, as this article says, among women around the world. cancer ranks in the top 3 causes of premature mortality among women in almost all countries. While we talk about, and of course, the lung cancer is among the worst, and then of course, cervical cancers can be cured, can be prevented by HPV vaccine, and so so that it is true that many of the cancers are preventable. Any other comment about these?
Yeah, I've got a comment about the ultra processed food. Um, and I think it's kind of unfortunate that we tacked ultra onto that, because a lot of people say, well, my processed food is not ultra. My processed food is fine because I like it. And because I like it, it's safe. But the whole key is to read the ingredients, and you get the alphabet soup on the end, because they usually put ingredients by percentage of content. And so all of the chemical additives, they're always at the end, and you look them up and you'll find out things like they say banned in Europe because they're dangerous. But you get a lot of information. Unfortunately, you either got to stand there with your phone doing a Google search in the grocery, or you actually have to buy it, bring it home, check it out, and then decide that you need to either return it or throw it away. But the real guide is, if you got an alphabet soup at the end of your ingredients list, just don't buy it. Don't worry about whether it's processed or ultra processed. The chemical soup at the end of the ingredients list means that you shouldn't buy it. Just forget about it.
Any other comments? Okay. Darryl always gives us good advice.
I will have to say that since I've been coming on this Zoom, I have stopped eating so many frozen dinners that I used to eat religiously because I don't like to cook.
Me either.
So I have cut down. I haven't totally stopped, but I have cut down.
Well, when you know better, you do better.
Well,
That's true.
Okay.
That's
I
true.
invite any of you to come out and spend a week with me, and you'll have a week of chemical-free eating.
Oh, God.
When are you coming back to DC?
I don't know. Buy me a plane ticket. I'll be there next week.
Oh.
Okay. Let's go to the next article. Interesting how, this is an interesting article about the so-called fried rice syndrome. And this is a term that is popularized by social media, but actually refers to food poisoning. And this is cause of food poisoning. This focuses on a 20-year-old who died after eating 5-day-old pasta left out at room temperature. And this illness is from food that isn't stored, including anything from grains and meat to cheese and pasta. So the fried rice syndrome is a misnomer, but it has to do with any kind of food you leave out. And it's interesting, you talk about a 20-year-old, because when you're young, you're kind of stupid. And you might leave something out and say, well, it's okay. But food poisoning is still something that, and this says you should not leave anything out for more than 2 hours unrefrigerated. And that makes sense. And also the data indicates that even that which is refrigerated or frozen has a timetable on it as well. And of course, Bacillus cereus is not the only bacteria that can cause food poisoning. But I think the real moral of the story is if you have anything that's more than 2 hours out, you should throw it away. Because that's the moral of the story.
You know, that means that if you're fixing Thanksgiving dinner, and dinner is at 4 o'clock, and the food is out and set, if they don't get there by 7 o'clock, you got to throw all that food away.
That'll be the day, huh?
We were on the same page, John. I was just getting ready to mention Thanksgiving is coming, and you know how long the food sits out.
Right. That's right, man. 2 hours is light stuff.
Right.
What I'm saying is, everybody, please be on time for Thanksgiving dinner.
Okay. Well, it's interesting how they did an anatomy of that case, and the association of the diarrhea and vomiting that he had after he did all of that. And he didn't, at 20 years old, he didn't have sense enough to do anything else. See, if he was living with his parents, they would have taken care of him. They told him, you know, they would have prevented him from eating anything that was 5 days old. I mean, gracious. Yeah.
That's excessive. Overnight, I've done that so many times. Fall asleep with my dinner after eating and eat it, pop it in my mouth the next day.
Well, be mindful of the potential.
I put everything in the refrigerator. I don't care. Almost as soon as I finish cooking it, sometimes it's still hot, I put it in the refrigerator.
Yeah. One of our sessions said that the limit on keeping it in the refrigerator was 4 days.
Yeah.
Unless it's in the freezer.
Right.
Yeah.
Sylvia is the freezing person. Sylvia freezes everything.
I'm close to that too. Right. I'm close to that too.
Yeah, my limit is 7 days. And around here, they all know Thursday night. What is it, everybody? Trash day tomorrow. Get that stuff out the fridge.
Amen.
Thursday night is gone. Trash day Friday morning.
My day is Monday night. Trash day is Tuesday.
Right. Mm-hmm.
Yeah.
Okay.
But I freeze a lot of foods too, though. What cook too much and it's still sitting there 2 or 3 days. I'll put it in a container and put it in the freezer.
I do that too, especially now I live by myself, and they're not coming in like they once did. So instead of throwing it away, after maybe 2 days, I'll put it in the freezer.
Mm-hmm. Where you live now, you still have the same trash day?
I'm still going back and forth, and trash day is still the same at both places because I'm only 10 minutes away.
Oh, I see.
Yeah, but today's Thursday, and I have more leftovers than anything because I seldom cook now. And but Kayla will be home next week. So she said, I want this, this, and this. So I'll cook it.
Okay, let's look at the next one.
All righty. Let's see what we got here.
Well, it's interesting. We spend so much time talking about nutrition. Is it worthwhile? Absolutely. I think we are what we eat. I guess that's what Darryl has told us on many occasions. And this article pretty much agrees with him in terms of identifying that there are many ways to skin a cat. So there are many different biological factors that tell you how to eat and what you can eat and what you shouldn't eat. And one of the things that we didn't learn very much about in medical school was nutrition. And that's a shame because as we age, we recognize how important nutrition is. And you wonder why. Of course, now that is not the case. When I came through medical school, nutrition was not taught that much. Now it is. We've learned from our mistakes in the past. And so the doctors of today have more interest and more education about nutrition. And that's something that is positive. Because in many ways, in medical school, when I went to medical school, nutrition was an afterthought. Now we recognize that nutrition is one of the most important medications that you can deal with is the food you eat. And as you go down this line, it just talks about how the patients can be involved in the food they eat and why the foundation of medicine is about nutrition and why individual diets are important. The avoidance of lactose for some, gluten for others, and also recognizing that we've got good and bad bacteria in the gastrointestinal tract, and that for all walks of life, it's important to so-called eat healthy. And I think most diets are now emphasizing fruits and vegetables. Some are emphasizing elimination of meats, and some are eliminating even seafood. But many are minimizing the amount of meats and emphasizing vegetables and fruits over anything else, recognizing that tailoring the diet to your particular needs is important. Many have talked about the different types of diet, including the Mediterranean diet and the other diets. But the important aspect of it is that the de-emphasis on meats and the re-emphasis on fruits and vegetables. I think that is the hallmark of most of the diets that are associated with long life. And then, of course, living over 65, 70, so forth. And so we now recognize that nutrition is the open door for longevity. And not even talking about the so-called processed or also ultra-processed foods. It's the issue of actually eating healthy. And any comments about the so-called precision nutrition, which is really a way of saying that fruits and vegetables are the key, and whatever else you want to add to it is okay, as long as it's not unhealthy. And of course, we all recognize that the way we process foods in the United States in many ways is very unhealthy. And
Dr.
so,
Callender, what occurs to me is that, for an example, a pregnant woman and the same woman not pregnant would probably have a different tailored diet, because I noticed that when women are pregnant, the doctors step in and they say, well, don't eat this and stay away from this. And then when the child is born, they can tailor their diet differently.
well, that's another interesting aspect, because the eating habits of pregnant women, that's another story, because they have strange appetites, and the obstetrician and gynecologist who works with the pregnant woman has got a real job ahead of them, because they have appetites for things that aren't as nutritious for them or the child. But any comments or other thoughts there? If you women have been pregnant, so you know what that's all about.
Yeah, pickles and ice cream, please.
Okay, let's go to the next article then. This is an article. I'm sorry that John Buchanan isn't here, but this is an article that is it ethical to compensate plasma donors? And many of you recognize that they used to pay for blood donations, plasma donations. Do you remember why we stopped?
Because it was unethical.
No, it's not why we stopped.
Wow.
Anybody know why we stopped? Anybody remember why we stopped?
No, I never knew they paid.
We rarely ever do anything for ethical reasons, by the way. I mean, it wasn't.
That's a doctor who said that.
No, but it's true. We don't.
I agree. I agree with you, but
yeah. But anybody remember why we stopped doing it?
no.
Remember Arthur Ashe?
Oh, yeah. I thought they still did it. I thought a lot of homeless people would donate
I
blood
get ready to say they do still
for
pay.
like $5 or something like that. I don't know.
They do still pay for blood donors.
Mhm.
They don't pay for blood donors. Now this is plasma donations.
Oh, okay.
Oh, mhm.
Maybe not
They
plasma.
stopped paying for blood donors because, remember, Arthur Ashe got AIDS from blood transfusion.
Blood transfusion.
And that's when they stopped it, because they realized that a lot of people who would come and sell their blood would get paid for donation, were sick. And so they stopped the process way back in the 80s. It's a long time. 80, it's amazing. 80 is, we're talking about 40 years ago, 80s.
But I know a guy who still goes and donates blood and gets paid.
Well, I don't know any place in this United States where they pay for blood donation. Plasma donation is a little different from blood donation.
Oh, well, maybe it's plasma, but I know he goes.
Yes,
that's his weekly job. It is. This particular person I'm talking about. It's his weekly job. That's how he he goes and donates. So maybe it's plasma, but I know he gets.
Yeah, just as I said, the United States allows for paid plasma donations.
Yeah, maybe
But
it's plasma.
but the blood donations that John is doing is for quite a while they've stopped paying for blood donors because
Yeah, I'm a blood donor as well. So no, I know they don't pay for that, but
right, that was one of the reasons because
okay.
And we talk now about ethical concerns, and but at least for the blood donors, and of course, one of the issues now, the reason this comes up, is because blood donors are still decreasing, and there's a great need for blood, as there is for plasma, and so the fact that they are paying for plasma donors, if they didn't have it, I don't know where we'd be, because there's a global blood shortage, not to speak of, in spite of the fact that they pay for plasma donations, still shortage of plasma.
Yeah, the Red Cross calls me 2 or 3 times a week to come and donate. That's
for plasma.
No, for just regular blood donation.
Right. Yeah.
Yeah.
They still take you.
Oh yeah. Yeah.
Amazing, because they used to have age.
No, I don't. No, I haven't heard them say anything about age lately.
Yeah. Okay. Well, that's good.
I'll be 80 in a few months. They still call. They still.
Wonderful. Well, that's good.
Last time I went, they took it.
Yeah.
Buchanan is given 100 gallons.
Yeah, more than 100 now. Yeah.
I'm a long ways from that, but I do.
Did you see his certificate? He showed his certificate on one of our group sessions.
Yeah, I did. Yeah.
I might not have been on. I don't remember it, but
like they say, selling plasma is a multi-billion-dollar industry. So your friend
probably plasma.
Okay. Right. And so the question is it ethical to do it? Well, here's the question: is it ethical to stop doing it? Because we think about it, if you didn't have the plasma, wow, where would you really be if they stopped paying for it? So,
Dr. Callender, my question is about the middleman, the hospitals, because the hospitals have to make use of the plasma and they have to charge patients in hospitals for whatever services they get, including plasma operations. So who is behind giving the donor the money? Who's behind that?
I don't know. I have no idea who pays for this $25 billion that is paid annually. Can you imagine $25 billion for plasma annually? So I just like you said, your friend that's his job.
Yeah, he goes at least once a week, twice sometimes, but at least once a week.
So what are your thoughts about any ethical reason why you would stop paying them? And what would be the consequences if you stop paying them?
I feel like if it's needed, they need to pay them and give them a minimum wage like they do everything else. Yeah.
Well, the fact that your friend is still doing it says it must be a significant amount.
Yeah, it must be. It must be.
And for every unit of blood, we use about 3 or 4 plasma units. Because the plasma has the fresh components in it that sometimes the blood doesn't have. Because it may be Yes.
In other countries, don't people can sell their organs and make money from it in other countries?
Yes. Even though it's unethical, yes.
Right, right.
Yeah.
But see, the thing about blood donation, when you donate your blood, then your body just compensates by making more blood for yourself.
Right.
Right, right.
In plasma, I think it's the same thing as the doctor.
Yeah.
Okay. So my point is this, what my question is this: what is platelet enriched plasma?
That's just plasma that, in other words, the blood has red blood cells. That's blood only, black blood cells. Now, whole blood has platelets and plasma with it. Okay. And so, platelet-rich plasma is plasma in which they emphasize the amount of platelets in the plasma, which is already in the plasma. And that's what they use to heal bone problems, arthritis, and all of those things, and there's a lot of controversy as to whether it's of any benefit or not. But anyway, it's a new type of therapy that we use for bone problems.
Dr.
Two-thirds,
Callender,
yes.
did people at one time, did they give athletes or something blood injections or something to boost their metabolism or something like that?
I don't know
Was that?
about one time because I'm not aware of that. No, that doesn't mean it happened. I'm just not aware of it.
I was
Uh,
thinking that they were doing something like that, and the Russian athletes, they were giving them um injections or something of blood to
yeah, they
boost
were.
them.
Yeah. As they were, and as a matter of fact, one of the bicycle scandals
Yeah,
was associated with exactly that, and
right,
for
right.
that
I thought I
reason,
was hearing
he
that at one
forfeited
point.
forfeited all of his awards because he was getting blood transfusion. Yeah, yeah.
Mhm.
So it's illegal for them to do that. Yeah.
Yeah, I seem to remember something about that you got a physical boost from getting blood donations from a young donor.
Yeah, and that's why that was disallowed. And as a matter of fact, for the bicycling races and marathons, they made that illegal. And if you did
Mm,
it, you would have to forfeit your prizes, which
yeah, I thought
happened.
I was a blood donor back in the 70s. I have O positive, and they used to come and get me, pick me up and from work, and I'd go and give blood and they'd take me back. And that I did that all the way up until I got when they came out with the vaccine for hepatitis, my job required me to have that vaccine. And once I had taken the vaccine, Red Cross didn't want my blood anymore.
Hmm. Well, this is an interesting article about the controversy about playing for plasma. As we already mentioned, uh, organ or bone marrow donations, paying for that is illegal. We have a law against that. Many other countries don't have that. And then egg and sperm donations are paid for as well. That's a big business as well.
Mm-hmm.
But with so many people needing plasma, and since we've already established the precedent of paying for it, it's unlikely that anybody's going to make plasma donations illegal.
Dr. Callender, this article's made me change my opinion. I think it's okay to do this way because just think about it. doctors and hospitals are in the business of saving lives, and this is one way they can do it. And the benefit is what I've highlighted here. Some of these poor people can go to college, get through college, and put food on the table at the same time. Double benefit.
Well, I think that, yeah, well, the bigger benefit is saving lives.
Saving lives, exactly.
Right. The other thing, that's a sidebar.
So what do they have? Do they have blood plasma banks like they do?
Yes, they do.
Okay.
Yes, because the plasma has so many factors that the antibodies in the plasma, and so many great things are found in the plasma.
I heard the O positive blood, they say that's can be used so many, is that?
A universal donor, right.
Okay, yeah, I'm O positive as well, and that's why I guess they call me so much.
Yeah, that's the universal donor.
Yep.
AB is a universal recipient, O is a universal donor.
Oh.
So that's the most desirable of all. O positive, or even O negative, whatever.
Yeah, they don't come pick me up, but they sure call.
Well, anyway, this is food for thought, but I think that we already become dependent upon it. To change it would be asking for trouble.
Yeah.
So it's a controversial issue, but to me, the fact that we have established the precedent and have been doing it for so many decades, it'd be unwise to change it now. I thought it was certainly fruitful for us to discuss this.
And speaking of the friend that does donate, I think some of the reason why is because he's limited as far as finances for jobs. You know, he doesn't have the skills for a higher paid job, so the minimum wage and stuff like that just doesn't cut it always. So that's just another means of him surviving.
Just as John pointed out, these are fringe benefits that for some are not fringe.
Yeah, I couldn't see
Yeah.
yeah.
So that's a very, very worthy article to discuss. Yeah. Okay. Next one.
All right.
This should be the last one, I guess.
We got three more.
Okay, well, it's 10:30 though, so.
Okay.
Yeah, I thought this would be an article that has this device that would stop menopause symptoms, which is hard to believe. But this device, which has not come, it sells for $299 as a way to manage hot flashes. Like we had talked about this before, but up until this point, there wasn't a device or medication that, except for estrogens, which addressed this. So they devised this new device that actually continuously monitors skin temperature, etc., and also eliminates the hot flashes. I don't know anybody who's used this non-hormonal treatment, but it's food for thought because the reason that people don't want the hormones is because there's a concern about increased risk of breast cancer,
Right.
which does not occur with this device. So anyway, this is just to be aware that there is such a device. The question is, how efficient and effective is it? And that's what this article does not identify, but it does say that it does work. I'd like to see the data on it, but on this device, I haven't seen that though. But it's good to know there is that device that doesn't have the risk of breast cancer. So, thought you should all know about that one.
I'd be more impressed with a device that would stop menstrual cramps.
Yeah, yeah. Well,
Just 4 years of those. And it's
yeah,
and a few years of hot flashes.
yeah. That's something to deal with. Wow. So
I,
my
I would
wife had,
I would really want to talk to somebody who did it, who used the device to see what they thought before I would.
yeah, I'd like to see some data on, yeah, more data on that. Yeah.
Yeah.
But your point is well taken about the menstrual cramps because wow, my wife couldn't go to work a lot because of that.
Oh,
Yeah, I'm telling you.
I was fortunate. I didn't have too many of those.
You're blessed.
Yeah.
I'll tell you. Yeah.
Yep.
Let's go to the next article.
Okay. This is the second to the last article.
Okay. Oh yeah, I think Dr. Bisa-san talked much about the fact that, and you guys actually mentioned, comment about sometimes the primary doctors are aware of all of the drugs that you are getting from the different specialists, and as a consequence, older adults are at risk from seeing different specialists who order different medications. If the right hand doesn't know what the left hand is doing, you're on too many medications. And older adults are particularly at risk because too many cooks spoil the broil, and and too many medications that are with one drug interacting with the other. The risk of polypharmacy is one of the biggest problems we have with older patients. And so, which is why geriatrician is a particular value, because they recognize this and minimize the polypharmacy that goes along with people who are over 65.
Right.
I have been fortunate to go to the same neighborhood pharmacies, not big chain stores. And I guess I've probably been going to this pharmacist for around 30 years or more. And they catch things, when they see that you have a medicine that coincides with something, they'll mention it and tell you to check with your doctors.
That's very good. That's good. The role of the pharmacist in helping patients with their medications is underappreciated.
Yeah.
But they play a major role, or they can play a major role.
Yeah, well, mine does. Yep. Mine really does.
That's good.
Yeah.
We talked before about the fact that some of these medications are, especially in the elderly, are responsible for increased risk for falls. And that's why it's important to know what medications you're on and what medications interact with one another.
Right.
Even now, your insurance wants you to order from the big box stores and get 90-day supplies. But I resist that. I stay with my pharmacist. I just,
Okay. Let's go to the next one, please.
Okay. And here is the last one.
Oh, it's the same
we
one.
already did that.
Yeah.
Yeah. Right, we already did that. Okay, so any other comments or issues that we need to discuss before we leave? Hey, listen, tomorrow is we're celebrating Veterans Day.
Yes, yes.
Any veterans on the program? No? Well, it's interesting because November the 11th is actually Armistead Day, it's Veterans Day. But I know Howard is celebrating it tomorrow.
Yeah.
I don't know how many other places are celebrating it tomorrow, but
Well,
the actual day is November 11th. You know, Betty?
no, I don't. I was getting ready to say when a holiday falls on the weekend, they celebrate. If it falls on a Saturday, the celebration is on Friday. Well, look,
Right,
and when it falls on a Sunday, the celebration is on Monday. So
right.
that's why.
Yeah. So enjoy your day off or whatever you have for it.
But I want to mention while we are here that Pearline, who usually is a part of the program, part of our Zoom call, I saw John on you all's invitation to your cookout this summer. I don't erase things off of my texts, and I saw that she had put on there that she had lost the contact to the group. And so I sent her the contact, but I don't know whether she just didn't go back and look at it. So I'm just telling you, so maybe you all can include her again.
Okay,
Yeah.
okay, because I'll call her and see if she got it. Yeah, I
Yeah,
saw that you had done that, which
yeah,
which
but
was
I
very
noticed
good.
she hadn't been on since then. So that's why I'm saying it could be that
Oh,
you just hadn't had a chance to.